Transvaginal fetal reduction in a quadruplet pregnancy with one sac containing a monochorionic diamniotic twin. Monozygotic multiple pregnancies occur when a single embryo splits before the 8th day after fertilization. If the split occurs in the first 3 days after fertilization, dichorionic diamniotic gestations occur. If the split occurs between 4 and 8 days after fertilization, a monochorionic multiamniotic gestation occurred. Several etiologic factors have been related to monozygosity after assisted reproductive technique procedures. This includes ovarian stimulation, manipulation of the zona pellucida such as assisted hatching and intracytoplasmic sperm injection or ICSI, blastocyst transfer, suboptimal culture conditions, and maternal age. This is a 37-year-old lady with 2 previous failed IVF cycles undergoing her 3rd IVF cycle. 3 embryos were replaced. 3 weeks after embryo transfer, 3 gestational sacs were seen. 5 weeks after embryo transfer, 1 gestational sac contained 2 embryos with 2 fetal hearts seen. Six weeks after embryo transfer, the separating amniotic sacs were seen. It was a monochorionic diamniotic twin in a triplet pregnancy. Transvaginal fetal reduction was performed using a 18-gauge needle, and potassium chloride was injected into each fetal heart, and aspiration of the fetus was done 1 at a time. Fetal color Doppler did not show any fetal cardiac activity after the procedure. Seven weeks after embryo transfer, the other 2 fetuses were growing well with cardiac activity seen. In the sac in which fetal reduction was performed, only 1 fetus was seen, which was small and no cardiac activity seen. The other fetus was absent. Eight weeks after embryo transfer, both the fetuses were normal and resorption of the reduced fetuses were noted. Nine weeks after embryo transfer, almost complete resorption of the reduced fetuses were seen. The other two fetuses were active and growing well. She is currently 24 weeks pregnant and the twins are doing well. Three embryo reduction techniques have been described: transabdominal, transcervical, and transvaginal. Transabdominal technique, which is performed between the 9th and 14th weeks of pregnancy, involves injection of sodium chloride or potassium chloride solution near to or inside the fetal heart, with or without amniotic fluid aspiration. The method entails a greater technical difficulty. Transcervical technique consists of a mechanical cervical dilatation performed between the 8th and 9th weeks, followed by an embryo aspiration through the cervix using a Carmen or a number 8 metallic cannula. This technique is no longer used on a practical basis due to the high complication rates. The transvaginal technique is performed between the 7th and 11th weeks by injecting sodium chloride or potassium chloride solution into the fetal thorax. More recently, the transvaginal technique has been performed with total or partial embryo aspiration. Another technique is a single puncture of the intrathoracic embryo region until asystole is verified. In this case, potassium chloride was injected into the heart and partial aspiration of the fetuses was performed. Thank you.